So it was really in that period when Fran and I were noticing the effect of what was happening kind of on ourselves and us in our own way seeking what could we do to kind of ground and settle and reestablish our resilience. And then I think also we noticed in our employees that it was happening. So, it was just becoming very obvious. I noticed it in my clients, just client after client after client. I could just feel it in their nervous system. And that led to asking the question. And there was not a single person that I interacted with that didn't have a story to share, even if it wasn't anything that was affecting them or anybody within 3 degrees of separation of them. They were still just soaking in the distress. So that led to Fran and I asking the question, what could we do? And again, Fran did food delivery and on our side, at home, it was helping drive people to work, so finding ways, but also it was what do we have that we could share? And this is something that we have that we can share. So both Fran and I, I'll speak for myself, 35 years of experience. I spent a good 20 to 25 years of that doing, I taught meditation for 25 years. I had mind-body groups. That was really the focus of what I did. The name of our clinic, Bhakti, coming out of the Sanskrit tradition and the Sankhya tradition, meaning devotion, right? So devotion to God. So that was my background as I came through, became the name of the company, and we've carried it on and kind of continue that idea of how we, our orientation in the clinic when we're working is devotion, right? Devotion to our clients' well-being and that. So both Fran and I have a long history in kind of mind-body skills and thought that's what we have to offer. And so, here we are, although it does, again, it has that feeling of the peak was here and we're here, but again, not really true. A lot of people who are still trying to find a way back to their baseline. And our hope is that we can kind of grow a group of people in the local community here who see this as an opportunity to come and spend time doing it here, just kind of grounding and building resilience here, centering and regulating here. But also, it was important to us to have some skills that we could really have as deliverables that somebody could not only do here, but take with them to do at home, but also share with their community of people. So we wanted some things that were pretty easy to communicate in that way. So that's what we're going to do tonight. We're going to talk about heart rate variability breathing, and Fran is going to talk about Voo Breath, and so 2 ways of regulating the autonomic nervous system. So we do have a bit of a presentation, not common for when we're sitting in circle, the talking stick, and can you pass the PowerPoint clicker, please? It's not common. But I will say again, part of my evolution as a practitioner, doing my own practice, having my own daily yoga, meditation, qigong practice, how that has evolved from kind of before I was doing, kind of neuroimaging, neurofeedback, really working on the nervous system directly in a much more kind of science-based way. I would say I'd always been doing it, but kind of analog, and now I do digital. And it's not an either or a preference, but it's just seeing how they inform each other. And as I was thinking about this today, I was reminded of, so a dear friend of mine, Tenzin Namdul. He is at the University of Minnesota now. He used to be the Dalai Lama's personal physician. So the Dalai Lama tasked him with being in charge of the Tibetan Healing Initiative, the Tibetan Global Healing Initiative, which was, Tenzin was then sent off as an emissary around the world to go to different sites of healing and across the board. So hospitals to indigenous clinics in the middle of nowhere, all of that. And kind of build relationship, send the message, create a network, gather information. And then the next leg was to the University of Minnesota, where he did a master's degree, and then to Atlanta, where he did a PhD, and now back to the U, where he's doing research. And the research project that Dalai Lama tasked him with was to create a paradigm to study Tibetan medicine in a Western science kind of way without violating the tenets of Tibetan medicine. And so our paradigm doesn't do that. Our paradigm wants to boil everything down to a single active ingredient and do a double-blinded placebo-controlled study. And their thing was like, no, you can't say take a plant medicine and take out one ingredient and study it. You have to study the whole of it, like not just the whole of the plant, but the ritual in which it's gathered, the ritual in which it's administered. All of that is part of the healing, not what we do here and think of the pharmacological chemical as what does that. So that's what Tenzin has been spending the last several years working on. He's primarily focused in particular on the brain, does a lot of EEG, studying different types of meditation to see how different types of meditation affect nervous systems and health. So to me, he kind of epitomizes that at the highest levels of taking academic research and traditional Tibetan medicine done at the highest level and bringing those together to make Tibetan medicine better. And what I found was like what Fran and I do now in the brain clinic has all made what I did for all of my years doing kind of more traditional path of yoga, meditation, pranayama, all of that has just gotten better in the sense of knowing how to apply it to get a more reliable outcome. That's what I mean by better, right? To understand that one meditation isn't going to work for everybody. One form of breath work isn't going to work for everybody. And not just everybody, but within an individual, the health concern that they have as a primary concern, how do we affect that, right? So how do we use pranayama, so breathing technique from the yogic tradition, to stabilize somebody's blood pressure? And you can't just pick any pranayama and you go, well, it's all good, right? And apply it to somebody's blood pressure and have a medical outcome. But it turns out, and so what HRV breathing is when Western science studied pranayama and said these different styles seem to affect the body in these different ways, and then a group of people pulled out the form of pranayama that showed the best results in regulating the autonomic nervous system and focused on that and really made that into a science. So that's what we're going to cover tonight, is what has science made out of, Western science made out of the yogic tradition of pranayama in this particular form of breath. And then Fran is going to do a different form of breath, but that has also gone through the rigors of Western medicine to help us understand what is the psychophysiology behind this technique and how do we know how to apply it as a specific tool. And so that's why the presentation is so that we can touch on a little bit of that, so we understand that the type of breathing we're going to do tonight isn't interchangeable with the 14 other types of breathing that happens. And that comes up all the time. People will say, well, can I just do box breathing? I'm really a fan of the Wim Hof method, so I'm going to do Wim Hof breathing. They're like, awesome, do that. Won't change your blood pressure, but you'll have a good time, and it might be good for 50 other things. But if this is what we want, if you want to control, kind of anxiety-induced gastrointestinal issues, right, then this breathing remedies that highly reliably, like in the 90th percentile. But this kind of breathing doesn't change that at all. Again, super good for other things, not if that's the outcome you're looking for, right? So it's that level of specificity that we feel like, again, the digital side versus the analog side, the digital side has helped us understand that. Yeah, Fran, if you want to click the button for me. So again, I'm going to spend as little time as possible on these. They're really just to kind of bring in the idea that what we're looking at here is a fairly holistic perspective. So mind, body, kind of our physiology, the emotional self, all of that in its own way, to understand what does each of those components bring to the table and how do we work with those so that we're working with the whole person. In that moment, I kind of left out, kind of mind, body, spirit. And I would say to some degree, the digital side hasn't really gotten into the spirit side yet. So it's not that we exclude it because we don't think it matters. It absolutely matters. It's just we can't put an EEG cap on somebody and see spirit. So we're not including it in the digital side, but it absolutely on the analog side for sure. So go ahead, Fran. So here, just, a nice image of the vagus nerve, so vagus nerve meaning wandering nerve. It's out, so it's the only kind of primary nerve that is outside of the spinal column. So our spinal cord housed within our vertebral column. And here we have the vagus nerve, which is kind of an analog to our spinal cord, but outside of the spine. And so it has a lot of legend and lore to it, and relation back to early development. But this is the main axis that we're going to try and work with through heart rate variability breathing, is the vagal side of the autonomic nervous system. So the sympathetic and parasympathetic, with the vagus representing the parasympathetic. And so here, just, some kind of touching on how this is kind of a mind, brain, body, autonomic, alimentary canal, like all of it. It really is kind of a holistic approach because of the role that the vagus nerve plays. There isn't anything that it doesn't have its fingers in terms of regulating us, again, psychophysically. So it's a big player. Go ahead, Fran. What we're going to do here is just watch a little bit of a video that is going to kind of show what we do clinically. And while it's up on the screen, I'm going to just orient you to some things. And so just to say a little bit about this person here, middle-aged woman, she came in with kind of chronic depression, probably a good 35 years of chronic depression. Had been very active in trying to resolve it, right? So she'd really worked hard, lots of therapy, medications, cocktails of medications, you name it. Eventually she got around to neurofeedback, us. And so here you see her doing neurofeedback. But in the end, what brought her to resolution was what we're going to do tonight, is the autonomic nervous system regulating and this HRV breathing. And so we're going to see a little bit of her evolution from one of the most dysregulated autonomic nervous systems that I've seen to a very well-regulated, and over about 6 sessions. So it was absolutely amazing, considering she spent 35 years and then 6 hours to resolve it. I mean, it's a remarkable story. She actually, after this, she exited our program. She didn't finish the neurofeedback. She didn't need to. She really has just continued to prosper ever since. So again, absolutely remarkable to see this simple technique change that in a person's life. And she's just an example. I mean, obviously there's millions of people that could fit into that category. Okay, so this is where this is our biofeedback. So we've got all kinds of interesting things here: temperature, skin conductivity. This is our actual heart rate variability. Yeah. So actual heart rate variability, which is the heart rate variability being the time between heartbeats. So the time from heartbeat to heartbeat should vary. Our heart shouldn't beat like a metronome. It should vary. Good. So this line the green represents her breathing. So inhale, exhale, as it goes up, inhale, down, exhale. And the red line represents her heart rate variability. And what we want to see, and we will see in the end, that the red tracing and the green tracing follow each other. They're in sync, right? And that's telling us that our cardiac rhythm and our respiratory rhythm have synced up. Right now, you can see there's virtually no correlation between the green line and the red line. The red line is doing its own thing, and that's what was happening for her. Her heart was just kind of beating as it wanted to. It was not being regulated. And so what we see so here we are into session 3, and you begin to see, even here, we just have a little bit of them coming together. So things are moving in a good direction. Her temperature is starting to normalize. At first, she was very cold all the time, so poor peripheral circulation. So her peripheral circulation is better. You can see here, still low in terms of circulation, but temperature is rising. So we're moving in the right direction. We'll be doing better when we see this. So again, here you can see we got a little bit of a following effect, the green and the red line. So her system is starting to find its way back into some type of synchrony with itself. And again, this is doing maybe 30 minutes of this type of feedback per session, where she's watching this screen when she's training. So she can see she's getting feedback on how well is her system coming into regulation. And that's the training side of it. Her brain is taking that information in. So over here you can see we were down at 10, now we're up to 30. So we've got a really big jump in peripheral circulation. So now her blood is flowing. Vasculature is less contracted, more relaxed, allowing more blood flow. Again, temperature is up. So things are moving in a much better direction. We got to be close to, if we're not already in session 5, and then I think session 6 is where we end. So we're almost there, where we'll have a chance to see a really nice, there we go. We start to see how the red and the green, we're getting a rise and a fall. So a really nice synchronizing between the respiratory rhythm and the cardiac rhythm are starting to sync up. And there's another reflex that we want to recruit into this, which is called the baro reflex. So we're trying to get respiratory rhythm, cardiac rhythm, and baro reflex, which is what's controlling the tightness or constriction, relaxation or constriction of our vasculature. So when we saw that number starting to go up, is telling us that we're getting relaxation. So the baro reflex, its function is starting to come back. And then this is the autonomic nervous system's ability to regulate itself. Now, we're looking at it through one particular lens here. We're seeing it in the cardiac system, in the circulatory system, in the respiratory system. But that same system is running digestion, kidney function, liver function, hormone function, temperature regulation. All of those things are being run by the autonomic nervous system. So even though we're just looking at these particular metrics, we know that all of those are getting better. And as her system started to just run better on a body level, this thing that was called a depression lifted. And I mean, just her life changed, her interest in social interaction, her life at work, what used to bother her and she would avoid, no longer bothered her, and she started to join in. The coming home and not having energy because she was just exhausted. So they're just collapsing on the couch, eating, watching TV. She would come home, she would go to the gym, she would go out and socialize. So her ability to participate in life is what came back, and all from just doing heart rate variability breathing. So Fran, go ahead and yep. So this is just a little bit of the information of how we do it. It's super simple practice, right? It really couldn't be easier. You can download a Breath Pacer app onto your phone. You can count it out as well, but it's just easier if you don't have to be counting in your head, and you can just let that go and really pace yourself with the Breath Pacer and breathe. And that's it. Like really, it would be difficult to come up with an easier practice that has this profound of an impact on health. So this information will be in what you guys get. So you'll have this, some suggestions for apps. You can generally find plenty of free Breath Pacer apps in the App Store. So they're ubiquitous. There's no like good one, right? There's just one that has sounds you like or picture images you like. Then that's the right one for you. So you just find one you like, and you're off to the races. So there is some more things like technically I could say about it, but for tonight I don't want to get into like the technical side of the practice. I want to just keep to just a simple heart rate variability practice. So in that sense, let's do that. So a couple of things around the doing of it. It's so diaphragmatic breathing. So we want to make sure that when you inhale, your belly's going out, and you exhale, your belly's going in, right? So the more anxious we are, we tend to breathe with our chest, right? So we use our upper neck muscles to lift our chest, not what the system is designed for. So that in and of itself will communicate stress into the nervous system. Just when we're using our scalenes to breathe, that will send signals into our nervous system that something's wrong. So not breathing here, breathing here. The next thing is it's not deep breathing. So one of the first things that people will do is they'll start taking deep breaths. You'll hyperventilate. In theory, your practice is for 20 minutes. Tonight, we'll do, like 5 minutes of breathing together, 10 minutes breathing together. So what you want to try and do is control the time of your breath, but not the depth. So not the volume of air you're bringing in, just the time, and let the other part of your nervous system decide how much oxygen do you need in and how much carbon dioxide do you need to offload. That's the volume of breath. All we're going to control is time. So it can take a little, a number of practices to notice that actually those are two different things, right? Most of us, they're stuck together, so we don't know how to get them apart. With some practice, you start to be able to separate the two. So all we're going to do is, in through the nose, out through the mouth. I'll put on a pacer so we can just kind of relax and let the breath pacer take us. And yeah, just that. So before we dive into that, questions? Yeah, it can be, absolutely. So sometimes people will do this laying down. HRV breathing, for all the reasons medically that we have people do it, laying down isn't optimal because our nervous system really changes between laying down and sitting up, like how it functions. So this is premised on not laying. Probably not standing, sitting, semi-reclined, but there's an angle that you pass when you recline, when your nervous system says sitting, laying, right? So we don't worry about what that is, but just to know, if you're doing this at home, you kick back in the recliner, recline too far, you're laying and your nervous system is now in a different mode. So it is to say it typically done sitting. So a hand on the belly can be a nice way to have that sense of, is your belly rising or not? Yep. Great. Any other? No? Okay. Great. So I'm just going to go over here to the phone and set a breath pacer here. I've got it ready to go. Okay. So that was the inhale sound. This is the exhale sound. Inhale, exhale. So you can be eyes open, eyes closed, whatever's comfortable for you. So how was that? Hard? Yeah. Say more. If you want to. Hard how?
Stop. Focus on my breathing. What do I need from the store? That's always been very problem.
Sure. Yep. Incredibly common, right? And so then that's what meditation practice is for, right? Here, in a traditional setting, a group setting, it's like just breathe. Whatever it's doing, fine. Just let it run amok, but breathe. Yeah, from a pranayama standpoint, but you're absolutely right.
I should try this while I'm trying to go to sleep. I should try, I'll think about doing it.
Right.
But I did find towards the end of it, I found losing myself in that sound, just automatically.
Yeah, good.
Calming.
Also very common. Yep. Yep, great. So that's an autonomic response, parasympathetic response to yawn. Very good.
I don't know if you know much about frequency healing and different frequencies you could do that too to help calm the sounds.
Yeah. Absolutely. Again, so yes, on both sides, but clinically we spend a lot of time on the digital side understanding the effect of frequency on whatever, the nervous system, what part of the nervous system on the brain, what part of the brain, right? Frequency responds how, body, kidneys, liver. Yeah. So there's a lot of time spent on the frequency side of it for sure. Yep. Yeah. Yeah. So I'm going to turn it over to Fran here. Unless, Fran, there was something you wanted to share from your experience.
One of the things Guy had talked about, he was talking a lot about blood pressure, and I've struggled with high blood pressure. And when I started doing practice with HRV, I just managed.
Yeah, it is.
All research, and it's good, valid research. That experience of it is just priceless.
Yeah, and I'm glad you brought it up. I was not going to bring it up tonight, but you opened the door. So Fran is a longtime meditator, singer, and so we had an ongoing dialogue for a lot of years around breath practice. And Fran was committed to her breath practice. And I did eventually talk her into trying HRV breathing and then what's called a person's resonant frequency. So that's a thing. So it's like a fingerprint. Every individual person has a resonant frequency where our cardiac rhythm, respiratory rhythm, and baroreflex line up. So that where those things happen, that's called our resonant frequency. When we breathe, do this exercise at our individual resonant frequency, we get the most benefit. So we did this with Fran to convince her. I had to hook her up to a blood pressure cuff and have her see that when she breathed at her resonant frequency, not what was comfortable or what she liked, her blood pressure regulated at the resonant frequency, but it didn't just regulate in the moment, it actually started to control it so that her blood pressure across time was managed. And so just breathing at, Fran really liked 4 breaths per minute. It was really slow. That was her thing. But, her training as a singer allowed her to be able to go a long time between breaths, which is great for singing. But that wasn't controlling her blood pressure. It was breathing at the resonant frequency. That's what did it. And again, that's the science of it. She had what she liked. I have what I like. But that difference between what I like and what's good for me, it's no different than food, right? Like, I like licorice. Turns out you cannot live on it, right? Not a long, healthy life anyways. So resonant frequency. So we were breathing at 6 breaths per minute, which is a 5-second inhale and a 5-second exhale. That may, the chances that that's any of our resonant frequency is small. The normative range is between 4 and 7, right? That's the range. The average adult is 6, but that's just the average, statistically average adult. So undoubtedly, you're a 5.5 or a 5, and you might be a 6.5 or whatever. So it is really helpful to find our own resonant frequency, and then there's ways to do that. Low tech is just with the Breath Pacer app, just try a few and just feel the sense of resonance in your body, and then trust that. Of course, there's a digital way. Come into the clinic, we hook people up to equipment, and that will help determine their resonant frequency, and then we can give that to them as a practice. But even breathing, like if you just did 6, you'll get probably 70% of the benefit of it just doing that, but you'll get 100% of the benefit if you breathe at your resonant frequency. But yeah, so my encouragement is download a Breath Pacer app, find a breath pace that you like, do 10, 15, 20, 20 is optimal, practice every day. And then every now and again, when you're just someplace, you're in the car, you're at a red light, you're on the phone, maybe talking to your mother, and yeah, sorry, Mom, and she tends to go on. And so then I can do 30 seconds of resonant breathing right there. And the reason I do that is to show my nervous system that in any moment, in any setting, it can regulate. Because that's what it's supposed to do. That's what we modern Westerners lose, is the autonomic regulation, the part that's supposed to be automatic. We lose that. So by doing this practice, 30 seconds here, a minute here, you teach your nervous system that it can regulate in any moment of stillness anywhere. And when it's trained, that's what actually happens, right? So if you're even at work and you're in a meeting and you're not talking, you're just listening, your nervous system should drop into this kind of breathing and regulate, and then back into action.
So I'm going to talk with you about another breath practice that is meant to help regulate. So Guy was talking about the vagal nerve, right? And so this practice is really meant to stimulate the vagal nerve, which will then kind of kick in the parasympathetic, which is the kind of rest and digest part, right? So when we are in kind of a state of chronic stress, one of the things that can happen is like the fascia in our body, which kind of wrap around our organs and kind of are protective in a way, can kind of get sticky. They're supposed to be kind of pliable, but they can get sticky, which can then cause like muscle tension or create more muscle tension. So this practice is going to help us with that. It's also going to help the digestive system in terms of basically what's going to happen. We're going to talk about what is called a Voo Breath. Peter Levine, who's he's a somatic psychologist who was kind of one of the first psychologists to really start getting us more aware of somatic psychology. So bringing the body into working with mental health. And he developed this Voo Breath as a kind of a response to trauma, but anxiety, that sort of thing. So if you just think stress, right? And so what the Voo Breath is going to have us do is not unlike what we were doing with the HRV breathing, and that we're going to breathe in and we're going to breathe out very similarly to the way we were when Guy was showing us the HRV breathing, no big extended anything. When we breathe in through the nose, we let that air drop down to the belly, and that starts to have an impact on the fascia, especially when we start to do the exhale, because on the exhale, what we're going to do is say the word Voo. What we're going to do is say it in a deep tone, kind of think about like a distant foghorn, maybe. And that kind of a sound is going to come out of us as we exhale. And what happens is those sound waves start to vibrate, and they'll vibrate, they'll stimulate the vagal nerve, which is coming down through your throat, through your chest, into the viscera. And so once it starts to stimulate that, the vagal nerve's going to send a message back up to the brain that says we're safe, right? When the brain hears we're safe, it can release, the stress response. And so that is the process that we're going to do. And what I really love about the Voo breath is, and there are like, we'll talk about versions of kind of the vooing that we can do like in public. Like if I'm standing in a line at the co-op, if I start vooing, perhaps people around me are going to, pick up their phones and either put me on YouTube or call for help or something like that. But there are other ways to kind of do that same process. But the idea here, again, being able to use this in any moment, first of all, to kind of calm, which is the goal we have here, right, is to get those systems back regulated, but also to start to create, again, a system that is calm. And so I work with first responders a lot, with firefighters, and I teach them Voo breath. That's when we do HRV and Voo breath. Those are kind of things that it doesn't matter what they come in for, they're going out with those as tools, because they have systems that, like that fight-flight system that we have, we never want to get rid of it, right? Because they live in an environment where they have to have that turn on. If they didn't, they wouldn't be able to do the things that they do to keep the rest of us safe and well. But that can get stuck on if it's repeatedly kicked in, right? Which is something you see. And so training that system to be able to kind of calm down. And so it's a good thing to do morning and evening, and then any time in between when you need it. And what I really like about Voo breath is, like, you can do 5 rounds of it, and that's the benefit. We don't have to extend the time. And so in terms of kind of the starting of the day kind of thing and at the end of the night, it can be just a really nice way to just kind of get that system back up and going a little bit. So the way Voo breath works is you're going to sit just like you did before. We're going to do diaphragmatic breathing. So I always, when people are starting to practice Voo breath, I like to have them put their hand on their chest and their belly. And sometimes when you're learning how to diaphragmatic breathe, we have you do this. The purpose for this, in this breathing, is not about that. It is more about having you have your hands here so that you can start to feel the vibration in your chest, but the goal being to start feeling it in your belly. So that takes some practice sometimes, but the idea here is that what we're really trying to do is get your system to come back to the body. Because when that stress response kicks in, it kind of moves away from that. It's in survival mode, so it doesn't have to pay attention to digestion. In fact, that could be a distraction, right? We don't need that. Like if a tiger came walking in the room, I don't care whether my food's digesting, I want to respond, right? That kind of a thing. So doing this is a nice way to start helping you kind of get used to kind of getting back into your body, sensing your body. And then after you feel like you've accomplished that, then Voo breath doesn't have to have this. You can just sit like this and feel it. So I'm going to show you a round of it, and then we'll start engaging in it. So when you inhale, you're going to inhale through your nose. You're going to, obviously, because we're saying the word Voo, be exhaling through the mouth. The important thing to keep in mind here is the inhale, again, is not a big deep breath. It's just a natural breath. And then the exhale, the Voo part, is also a natural breath. People have a tendency to want to hold it out like a really long note or something. That's not what we're looking for. We just want that to be a little bit of you're completely emptying your stomach. One of the things that happens when you're in stress mode is that your diaphragm can kind of get blocked. And so I'm sure it's a familiar thing to say, I don't breathe, I don't feel myself exhaling. We find this a lot when we're working with people in the clinic. They start to realize, oh my God, I wasn't letting the air out, right? I have a whole bunch in there still. This Voo will allow that to happen, right? And that, as that unlocks, again, it's part of that safety signal back to the brain. So it's going to look like this. I'm going to do it with my eyes open, just because I'm used to doing it that way. But I would encourage you to do it with your eyes closed just for tonight, or at least for part of it, so that you can let your mind just settle on your body, okay? So it's going to look like this. And then when I get to the end, before I quickly inhale, I take a moment to just feel into what that feels like. So you get to the end of your Voo, and then just allow yourself to sort of feel, what does that feel like? Do I feel warmth? Can I feel tingling? What am I noticing, right? So as we do this together, unlike when we were doing HRV to the pacer, we were all just pacing at the same rate. Your Voo might last longer than mine. And so I'm going to encourage you to just do your own Voo. And if you get ahead of one of us or behind one of us, that's the right thing to do, because you're doing it at your pace, okay? So we'll do this, we'll practice it, we'll go through 5 rounds of it, okay? So go ahead and inhale. So what'd you notice? Yes, it is my tendency. Yeah. Anything else?
Being self-conscious of my voice.
Yeah.
And
Yeah.
then really, like,
Quiet. Yeah.
no, it did sound more like the foghorn, but I was surprised at that.
Yeah. 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 Were either of you, or Guy, were you Vooing? I didn't hear you Vooing, and okay, you were low. So what, were you able to feel like the vibration anywhere? In here? Yep. Not down here. Yep. Yeah. Yep. Yeah. So the idea of like the vibration, right, is stimulating that vagal nerve has little branches that go out all over up here. And so great that you could feel vibration in your ear. Like any time that vibration is happening, it's going to help with the stimulation piece. And so when you're by yourself, you won't be self-conscious about this. I don't believe you will be. If you have pets, it can be interesting, because some animals don't like that sound, and some seem to think that it's time to sing when that sound is going. And so, but this practice, if you engage in this, and it took us, 3 minutes maybe to do this, right? Morning, nighttime. Again, like Guy said, not laying down, sitting up, right? But it can be a really nice way to calm your system. So like right before you're going to lay down and put your head on the pillow, Voo breath can work really well. So because kind of that mechanism of stimulating the vagal nerve, so if you're somewhere where you're feeling self-conscious, or someplace where you don't want to do the actual Voo, but you want to get the benefit, there are things you can do like humming. And so because again, that can be really stimulating to the vagal nerve. I tell this story frequently. Met a woman and got to know a woman at one point who was very anxious. You could just kind of feel her anxiety, just a general anxiety around her. And what I started to notice about her is that I would hear her humming. All of a sudden, she would just be humming. And it didn't, I don't even think she was aware of it. And then as I started to think about that, and I had all of this knowledge about vagal nerve, it occurred to me how the body sometimes is trying its best to help us get back to where, we function more optimally. And I think that tendency to hum likely calmed her without her intending it to do that. Right? But it had a tremendous, because you could tell. I would notice this. I would end up riding in a car with her frequently when I was around her. And she would go, just anxious. And she would just start humming, and she got pretty calm, right? So humming is another way to do that as well. Several other vagal nerve stimulation ideas in here. And so this one is an easy one where you're right here. And so this is the kind of thing where when you're going to want to, if you go back on here and look at when Guy showed the picture of the vagal nerve, so you get a real good sense of where that is. And you can do this in a meeting and no one would have any idea, right? It'll look like she's just, whatever, right? So that can be really helpful. There's a part kind of right in this area by the ear here that you can sort of push on. So that can be another one. This vooing is going to be a quicker route to the vibration and stimulation happening, but that can be a spot. And then there is, you want to flip the, thank you. There's the Orienting Scan. I love this one. I'm going to out myself to any clients that I have right now. When I am doing therapy, I will use this. If I am in a place where things are getting kind of stressful or whatever, and I feel like I need to regulate so that I can continue to co-regulate, I will use this because it looks like, I mean, nobody knows I'm doing it. It's not interfering with anything. But this Orienting Scan is really just kind of taking your eyes and moving them from one side of the room to the other, your head like this. As you do that, finding something that makes you feel calm, right? So both of you immediately where my eyes go, I love the color blue, and you both happen to be wearing blue. So as I scan here, though, that calms me, right? And so I'll land there for a minute and let that go into my system, right? And so that is a simple thing to do. And again, you can do that in a variety of places. When you're helping, at your work, if you're kind of in a profession or any kind of work where you're around people that are stressed out, co-regulating is so important, right? How we are really impacts how they will be or continue to be. And so being able to do something as simple as this, so I oftentimes have clients put like some object in, like if they're in an office space that's stressful, bring an object that really is calming, not one that I like, right? But one that calms you, and do the Orienting Scan when you need to. It's kind of like engage the sympathetic first. So that's the fight flight, right? But you get up and you do something like, I'll have my clients do this. They'll get up and stand and just stomp for a minute or two. We just stomp, and I'll stomp together with them because why not engage my system, right? And then once you sit down, you immediately transition to that 1 or 2 minutes of, and I usually have them just do Voo Breath then at that point, right? And so again, is getting that system to be able to, when it's optimized, it can flip between the fight, flight, and shut down to the kind of calming or rest and digest system. That's the way it's supposed to work. And so this is a way to start to optimize that some. Yeah. And then we have in here, because we must not forget the kiddos. So, I don't know if you happen to be driving children because their parents can't drive them to school right now, and you feel the intensity of the anxiety that they have. Children too, right? It's just that you get a little bit more creative with kids around this. And so these are just some ideas of how you can do this same thing, which is stimulating the vagal nerve in a way that makes it kind of fun. The cold water here is for those of, I always think about this. When I was younger, we used to always watch movies and somebody'd get upset or whatever, and they'd go in and wash their face. And I used to always think, why do people do that? Did you sweat that much? Well, when I got older, I found out that good research that shows that impact of the cold water, that stimulation on the nerves. Think about it, that vagal nerve branches out everywhere, actually can stimulate the nerve. Yeah. And so throwing cold water in your face can be good. So for kids, you can have a blast with them with that. And so this is just a good, I feel like, if you don't have your own kids, your own grandkids, share this with somebody that does, so that those little ones who have been a part of this environment, who are also feeling the collective stress, this world right now, that they have these resources available as well. That's it. Yeah. So this is what we wanted to share with you tonight, is some really, some of the, like Guy said, the science behind things, because we have a passion about that, but also some tools that you can take with you so that you can help yourself to be able to stay as well regulated as possible during this time that is quite stressful for many, many people. And then something that you can share with other people as well. Once you get over your being self-conscious about your food, you can start to share it with others. Yes.
Releasing like
Yes. Yes.
and that's how I like manage my stress, because if I don't do that, I might say something inappropriate to him.
Yeah.
Not say,
Yeah. Yeah.
"Tell
Yeah.
him F off."
Yep. Exactly. Yeah.
So I maybe I can do instead of
I like it.
the huff.
And you could have him voo with you. You guys have you seen Rent, the musical? Yeah. So when Mimi is singing moo with me, or it's not Mimi, it's I can't remember the other character. I always think of voo with me, and I want to say voo with me. Yeah. So the two of you could do that together.
So around that, I love, I'm so glad you said that, because so there's this whole area of research on what's called stress sharing,
Mhm.
and the why we do it. We can think of it in your examples like on a, like social level, people, but it turns out our body does it on every level. Our body does it. Like, so our cells do stress sharing. How they let each other know that the environment isn't optimized, so maybe to call in an immune response. So this idea of stress sharing, so that when we do that, it's a reflex. Part of it is like you kind of offloading, because it does do that, but it is also a signal in the environment for the environment to help attune to you. And so I wouldn't necessarily get rid of it.
Yeah.
Because it has a role. We don't all relate to it.
Yes.
People are like, I'm stressed. You're signaling to me you're stressed, but now I feel like you're stressing me out.
Well, I don't even know that I'm doing it sometimes.
Ah,
He's
yes.
the one that pointed it out. Oh, there's the huff.
Sometimes I bring my dog in when I'm working, and she is incredible. I'm thinking about the stress sharing, because inevitably, she'll just be laying out on the floor, what we think is sleeping, but she's sensing, right? And there'll be like some heavy stress happening, and all of a sudden Pixie will just be, and it is like, it's like, and what's beautiful about it is it gets our attention, and for the client, that's all they need. I don't have to say a word, right? But that idea, yeah. So
that's exactly what it's designed for. You're unconsciously, reflexively signaling your stress. It sounds like your husband notices it. Conscious to you. So what was unconscious becomes conscious. Then, there may be like lots to be said around like how that moment could unfold optimally, so that your stress level goes down and his stress level goes down. But that's what's happening. And so on one hand, we don't want to get rid of that. On the other hand, what are some of the ways that we talked about tonight to help decompress the system so that that reflex goes off less, and that reflex could become the signal of I need to do my practice. Like my system just told me it's time. And so so there's perfectly said.
Thinking about your circle process and how you could start with the Voo breath so that everybody is
Start a circle.
Yep.
So
yeah.
Thank you both.
thank you.
Yeah.
It's really great.
Good. Yeah. Great. We'll send you this, and then you can feel free to share it with anybody else. Yeah. And then we'll be back here 2 weeks from tonight. And so we'll just,
Is it going to be the same presentation? Well, but if there's more people, we might have to, because they're new.
Yeah.
So like part of our conversation was like both Fran and I have like big toolkits, right? And it was like, well, how many tools should we try and bring out in one night, and what's enough and what's too much, and all of that. And so, the good news is, as we do this through a series, we can flex with who's Somebody will be, let's just do it, because now we have a shared knowledge, so we don't need to talk about it. We can just do it. And then maybe we add in a new tool, each time, so that people who come can pick up. So some practice plus learn a little.
And there is such value in doing it together.
Optimizes. And that's why the traditions, right? They do these things together. You meditate together, you do pranayama together, you do your yoga together, because there's an understanding that we what you get out of doing it in a group is more than what you get out of it doing it on your own.
Yeah.
And so that collective pooling of the resources, each individual gets more than their of it. And so co-regulation turns out to be just a really efficient way to do it.
Yep.
And so, yeah.
Yeah.
All right.
Thank you.